Okay, it looks like we are at 102, so I'm gonna get started. Um, if it would be helpful for us, while I'm introducing everyone, Jamie, would you mind keeping an eye on the participants who are joining and are in the waiting room? Would you just mind admitting them in?
Sure thing.
Thank you so much. Okay, so welcome everyone to One Region, Many Paths, exploring health and equity across transportation policy and advocacy. My name is Belinda Chu, and my pronouns are she, her, hers, and I am the founder of A Healthy Blueprint, a platform aimed to provide climate and environmental education and resources to help individuals and companies achieve a livable, equitable future. I also serve as a project manager for PHEAL, which stands for Planning for Health Equity, Advocacy, and Leadership, which Jamie will briefly introduce before we begin. Jamie, do you want to step in for a moment?
Sure thing. Welcome, everybody. Thank you so much for taking the time out today to join us. As Belinda mentioned, I was just going to give you a brief overview of what PHEAL is. I know a number of you are familiar either through being involved with some of our previous work or with our APA Health Equity and Planning Interest Group. But PHEAL was created in 2020 in partnership. Actually, I noticed some names on here with a number of you all who are with us today as a response to two crises, the COVID-19 pandemic, which exposed patterns of health inequities in communities already overburdened with health inequities, and the explosion of long simmering racial tensions that culminated with the death of George Floyd. That May, a group of 77 practitioners gathered to develop the PHEAL principles as a call to action to respond to the health risks and racial injustices in our communities. Today, professionals and practitioners entrusted with planning, design, construction, and maintenance of the built environment use PHEAL's guiding principles as a tool to help institutionalize and operationalize big health equity words, health equity into their work. I would be remiss if I did not recognize Miguel Vasquez, who brought us all together initially and who still continues to lead our work. He was unable to join us today, but sends his regards.
Thank you so much, Jamie. Okay. Okay, so I want to start off by acknowledging the land and sovereignty of the Native and Indigenous nations in North America from where we are currently presenting. We invite you to consider donating to the Indian Land Tenure Foundation or the Indigenous organizations listed on NASIG. So I want to thank again PHEAL and the APA Health Equity and Planning Interest Group for co-hosting this webinar with me. And if you haven't seen the updates on our socials, the APA National Capital Area Chapter is our partner as our CM provider. So thank you again. So before we officially begin, let's go over some housekeeping items. There's closed captioning that is available for this webinar. So if you would like to toggle them on or off, you can go into your menu bar and click on closed captions. We will also have a Q&A towards the end of this webinar. So if you have any questions for us, please feel free to type your questions to everyone in the chat. That is currently set as a default right now. Our webinar is being recorded and will be posted on our websites, and the slide deck will be shared over email. Now, I'm very excited to share a little bit about each of our speakers. First up, we have Alex. Alex has worked in journalism, advocacy, architecture, construction, and transportation in DC, San Francisco, and Cleveland. She is currently the DC Policy Director at Greater Washington, seeking to increase the production of housing and affordable housing and reduce trips by car in the District of Columbia. Alex has written about all of the above for City Lab, Slate, Vox, Washington City Paper, and other publications. Next up, we have Jamie. Jamie is a planner, advocate, connector, partner, and mom. Before serving as Assistant Director of Planning for the City of Greenbelt, Maryland, she was with DC Health's Office of Health Equity, say that 3 times fast, and previously served as Deputy Director of California Walks. Jamie volunteers on the board of her kiddos' school community organization as an Awesome Foundation trustee on PHEAL steering committee and as the chair of the APA Health Equity and Planning Interest Group. And last but certainly not least, we have Dan. Dan is Greater Washington's Regional Policy Director, focused on making housing more abundant, accessible, and equitable in Maryland. For a decade prior, they were a transportation planner working with communities all over North America to make their streets safer, enjoyable, and equitable. Now I'm very excited to turn it over to Jamie to start the conversation.
Thanks so much, Belinda. I'm really excited to be here today with Alex and Dan, who I have known for possibly decades now, which is a wild thing to say. So this is a fun conversation. And I think our hope is that it will be a candid conversation about transportation, about how the public sector and advocacy does and does not necessarily work together and can work together, and about equity and health equity and how it ties into that work. Wanted to say that we know that policy can be very, very different across a region. We're coming from all over the country here, and how advocates and practitioners tackle and approach the same challenges can be vastly different as well. So we may touch upon or hope to touch upon how current transportation and land use policies and advocacy align or don't with health and equity outcomes for communities, the role that community outreach and public input play or don't in achieving equitable outcomes, and how to better integrate health equity and interdisciplinary work into our transportation planning, and if any other lessons learned to date come up. So we're going to start with a moderated conversation amongst the three of us, but we really, really want to get to your questions as well, and we'll leave time for that, which reminds me to set my timer. Dan and Alex, did you want to add anything to your various backgrounds or your general approaches to transportation policy and advocacy before we dig into some more specific questions?
Dan, I think you should go ahead.
Yeah. All right. Hi, everybody. My name is Dan, they, them pronouns. As said, I lead our policy in Maryland for Greater Washington. But before that, for a decade, I worked as a transportation planner primarily for consulting firms. I worked all over North America, helping to design safer streets for walking and bicycling, and a lot of complete street stuff. And if I had to describe the sort of approach I take to equity in transportation, it's that equity isn't the icing on the cake, it's the cake. Occasionally, I have gotten and continue to get in trouble for not saying equity enough because it is so incorporated in how I think about things and when I draw on my lived experience as a child of Caribbean immigrants who grew up just outside of Washington, D.C., or the experience I've had working with really diverse segments of the public. It's hard to tease equity out of that, right? In many ways, I think it is usually oftentimes the most common sense approach to doing something is the equitable one. I think that might be a theme as we go on further today, that if we're really trying to make a transportation network that works for everybody, we don't always have to overthink it. So, yeah.
I don't have too much to add. More of a programming note is that Dan and I are not current planning practitioners. We're advocates. We work for an advocacy organization. Dan has been a practicing planner in the past. I have not been. So when we were putting together this webinar, it was interesting because we're not going to talk about case studies today. We don't really have those. Our job is to move the Overton window, move the narrative, try to get to the world that we want to see, right? And include our base and in something bigger than themselves, right? So I hope that as we're talking, you all put some questions in the chat because we don't have a lot of slides. We maybe have 2 slides. Ask questions, give us some anecdotes that we can respond to, because I think that will make this really, really valuable, over the next 48 minutes. But the, you know, the, it's real, right? Are you saying equity, or are you incorporating equity into your work as a baseline? We work on housing, transportation, and land use in the DC region. We're not just transportation advocates. So we get intersectionality in there from the jump, which I think is really, really powerful, right? We're not just stuck in working solely in transportation. We have the flexibility to talk about housing affordability and attainability and accessibility, as well as where those things are and what regulates that. But largely, I think, you know, we are trying to look at just how dangerous, unhealthy, problematic the status quo is and change that, which sometimes doesn't mean you say equity a lot, which, you know, I love our funders, but sometimes that presents some problems with a grant application if you're not using the right words. Squaring that up with how to actually do something in practice is something I think that we're looking at on a regular basis.
Thank you. And I think for me, just to provide a little more background on myself, so I am currently a practicing planner, a practitioner, and was previously on the advocacy side. And I think the challenge that I've seen is that I had a great time trying to talk to, teach folks about co-learn, co-design opportunities to build equity in their work, particularly around transportation, when I was on the advocacy side and when I was more on the policy side. Then the opportunities that I actually have now that I'm back on the practitioner side. And that's a challenge that I see and I feel like I've heard from other practicing planners that is also the challenge. And so I feel like on my end, I do need to bring up the terms more in the meetings that we have, and in the conversations that we have, and in the grant applications that we make, in order to make sure that it continues, that equity, that health equity are able to be brought to the forefront of the work that we're doing. Otherwise, it's very easy for those things, I think, to get left behind until we fully bake them into the cake, to use, I think, Dan's analogy, because it's not baked into the cake. I think of a lot of the public sector work that we're doing just yet, even though we're very aware as practitioners of the value and the need and the dire need to be working from on an equity perspective on the work that we're doing. So with that, I think one thing that came up in our earlier conversations that we really did want to dig into, that I think a lot of us find as a challenge, is public input and where public input fits into the work that we're doing. So do you all think that planners' expectations about public input that they need to solicit, which sometimes is a checkbox, is realistic? And whether they're soliciting that input for the greater good of the project, or for the planning, or is that for themselves, for a client, for a board, for a grant report, and how that public input can or cannot be tied, I think, to what we see as equity. And is equity tantamount to public outreach and public input as well?
I think public input has its place. I think it's important for planning practitioners and especially decision makers to understand sort of the limits of public input, right? You know, when I was working as a transportation planner, you know, one of the things we always pushed for was more interactive forms of public input. Instead of the meeting at the middle school on a Tuesday night, it was, you know, me with my posters in front of a bus stop on a street corner in South Baltimore, asking people about their lives. It is often more expensive and time consuming, and you may not talk to quite as many people, but you have much more meaningful interactions and you speak to a much broader swath of the public that way. And I think those interactions are actually probably more useful than what you might get in the traditional sort of setting where you get folks who are like self-selected to attend, which we know from research tends to skew whiter, wealthier, and more opposed to things. At the same time, sort of going back to what I was saying about common sense, right? The image I usually have stuck in my head about the where should decision makers be here, how they should be hearing from the public. It's what is the person behind them in the grocery store thinking, or what is the people at their kids' school thinking, or what have you. And these are folks who will never ever go to a community meeting, never write their council member, just never participate in the public process in any meaningful way, no matter how hard you push. Uh, what they want is for their government to deliver them things, right? And I think, I don't want to speak for Alex, but I think we feel that elected officials and decision makers have to start there, right? They have to begin with the assumption that the public wants them to do their jobs.
Yeah, we talk about this a lot, and I think it holds as true for transportation as for housing, that you can move the meeting to a better time, or you can do one-on-one conversations with people at bus stops. You can provide childcare, you can provide food, you can pay people for feedback on things. Those are all really, valuable ways to meet people where they are. I've gotten to both do some of that and participate in some of that, and it's really, really cool. I am genuinely interested in what people think about where they live, how they get around, how their lives can be better. But even if you do all of that, right, you are not going to hear from people. You're not going to hear from everybody. And I think that we need to be more okay with that and find ways to work around that. One example that I use is that the District of Columbia, where I live and work, has an incredibly hyper-local level of governance called advisory neighborhood commissioners. They are elected. They represent about 2,000 residents. This is our lowest level of elected representative government. And that's 2,000 people. I have a lot of friends. I don't have 2,000 friends. I don't know what 2,000 individual people think, right? And that's our smallest unit of representative elected government. So even A&C commissioners, who we try to support through our work at GGWASH, don't know what all of their constituents think all of the time. They know what people are telling them, but they don't know exactly what everyone that they represent thinks. And I think that's fractal, right? It scales up to council members to an executive level about the same proportion, right? You hear from people, you know what the people who talk to you think, but I don't think you can ever truly know what the community thinks. And I think planners, advocates we're all kind of on this journey, right? But I think one point along that journey is accepting that may be the case, is that no matter how many resources you provide, and no matter, how greatly you can meet people where you are, some people just are not going to show up. And how do we make sure that they are able to live sort of robust and full and dignified lives? So I don't know that we answered the question of is equity tantamount to public input, although you heard what Dan and I think about public input. But the reason that I think we wanted to address that head on is because I'm sure all of you have seen, in the same ways that we have, governments incorporating public input either in good faith or as a way to sort of check the equity box and just sort of we heard from the community as the equivalent of this project is equitable. I think it is fair to say that is a common thing that happens in either projects or even long range planning, is that's the equity box to some degree. Dan and Jamie, would you say that is fair?
That what is the equity box?
Oh, that in sort of both projects and in long range planning, there's this trend, I would say, of both governments, maybe consultants, sometimes advocates, of saying, we've done the public outreach, therefore this is now equitable.
Yes, or we finally added snacks, and maybe coloring pages is childcare, and which has also been a challenge, even paying for the snacks with government funds. So yes, and I've advocated for some of those extra add-ons, and I do see a question that we can talk about a little later about how to encourage folks to attend these meetings. And I think that I think both of you are also alluding to the fact that it's not attending the meetings necessarily that's getting us to these answers. It's that what we've been doing is holding the meetings because that seems to be the easiest for us, or what we're most resourced to do, frankly. In some cases, we're not necessarily, we're kind of under-resourced to do some of the engagement we really could be doing, and are constricted by grant funding often, by federal policy, since a lot of that grant funding is trickle-down federal funding, and sometimes by the politics under which we work. Yeah. Did anybody want to talk about the how the politics can tie our hands in, and how that can kind of be toxic in a lot of ways to our efforts of trying to get to equitable outreach or to equitable outcomes in the work that we're doing?
Absolutely. I mean, I think one challenge, especially working with politicians and elected officials, is this perception that, the people who came to the community meeting are the most invested because they took the time to show up. And we lowered the barriers by providing snacks, and I'm a big fan of snacks, one track mind. So clearly, the people who are also motivated by the snacks are also the most invested. And the result can be that, one bad public meeting can derail a project, right? Regardless of the merits of the project, regardless of whether the project was equitable or not. We had a meeting, the people didn't like it. Therefore, the equitable thing to do is nothing. And we should know better, right? Like, nothing just means preserving the status quo. And I think that part of the challenge, I think, is sort of deprogramming like the perception of like what the value of the community meeting is, and that the value doesn't come from people going out of their way to participate in the public process.
Yeah, I mean, even some of the best elected officials that I know who take a really sort of policy approach to things that are not sort of that they have structured the work that they do to not be immediately about addressing constituent services complaints, do have to, just by the nature of what this is, deal with very, very vocal people. And even when they know that they're not representative, they still take up time, right? And that is just reality. That is a fact of things. And I think, there are definitely electeds who would just prefer for things to be uncomplicated and for conflict to go away. And I think I don't hold that against anybody. Like, there's a lot of times where I don't want to deal with conflict and I want unpleasant things to go away. Elected officials, they're just like us. But all of what we're doing is political, right? I feel like that's something that I've said consistently throughout my career. And one of the things that I value about the work that we do at Greater Washington is that we have both a 501c3 and a 501c4. And so we are able to endorse candidates and work with particular candidates, which if your organization is solely a C3, you can't necessarily do. I find this just so important in acknowledging that, like, this does come back to the decision makers. It's not about the advocates. It's not even necessarily about who shows up. It's about who owns the project or the plan, and who is making the final decision. So that is something that is really powerful that we can engage in, is both explicitly acknowledging that transportation projects are political, housing projects are political, and that the decision makers behind them are political creatures, and we need to engage in the world that they live in. Not all advocacy groups can or want to do that. It is, again, it's riskier. It results in more conflict. Sometimes it puts us in some hot spots. But I find it very, very valuable that we are able to engage in a way that decision makers also engage, which is electorally and politically.
Besides engaging directly from your perspective as advocates in an advocacy organization, besides engaging directly with political leadership, have you found yourselves either in your current roles or in previous roles or in your ideal roles, engaging with folks like me who are the practitioners who are being responsive both to, well, not even both, multiply to residents, advocates, and the political leadership, and kind of being tugged in all of those ways? And I think that one caveat for that for me is, and I know I mentioned this in our discussion earlier, is that it is sometimes frustrating to me that I'm asked to like sit through another complete street symposium, and I know what a complete street is, and I know how to build a complete street. And if somebody gave me a check and let me, you know, remove the parking to have the land that we need to make a street complete, I would gladly do it in a heartbeat. But that is just not the reality. And so I'd love to hear more about your perspective on how advocacy can really work with those of us who are on the ground in navigating those political challenges as well.
One of my favorite questions to ask when I am in a position to ask it is to talk to staff. I love talking to staff. Staff are my favorite people to talk to, and ask them what they need. And, you know, that I think sometimes it is really tempting to be an interest group and put our designs on things and say like, well, we want to reduce trips by car, and that means we need to remove all the parking and do this, that, and the other, and we need to come at it like really quickly and really fast, and people are showing up in opposition and we need to turn people out to counterbalance that. Oh my God. And you know, I've seen that, right, where advocates and myself earlier in my career got like kind of freaked out about, oh, we got to counterbalance all the negativity, right? But oftentimes that just gives staff more work, or makes it harder for staff to present to their bosses or their bosses' bosses like what is going on, because it supersedes the project and becomes controversial. So I really like being able to hear, like, you know, what do the Jamies of the world need? Sometimes it is turnout. Sometimes it is, hey, do you have any thoughts on how we can make outreach more inclusive? But often it's like, can you find an example from another place? Or, or do you know someone in another jurisdiction that I can talk to? Or do you have this piece of research? Or have you guys ever worked on something like that in the past? Those are really rewarding and valuable conversations that when I have the opportunity to have them, like those are really, really cool, because it feels like we are actually meaningfully pushing something forward together. And it's not totally dependent on just like, oh, people oppose this. Oh, we got to find people who also like it. And then that becomes about the turnout, more so about what the project is actually doing.
Yeah, I totally agree with that. I mean, this is a recurring thing that I'm working with right now, and some of the things that we're doing in Maryland is this I think fear that the only way a project can move forward is by responding to opposition and countering it, as opposed to what is the actual thing being discussed. And that's a conversation I'm much more interested in having. Um, you know, the thing I always try to say when I also talk to elected officials or staff is to try to be a resource to them, right? You know, we as advocates get to do we get to be political cover, right? Because we can turn people out, but we can be so much more. We can be a confidant, we can be a provider of resources, we can connect people. I mean, I think the most powerful moment for me over the past couple months in my work is I brought elected officials from Maryland to a jurisdiction in Virginia that was doing the same thing. And you know, me, I just assume that all the elected officials are all talking to each other all at the same cocktail parties. No, there's a river in between. They don't talk to each other. And the surprise when the folks from Maryland realized that the folks in Virginia had gone through the same challenges and the same opposition, and they had just the solidarity, right, of dealing with the same experience was really meaningful. And that wouldn't have happened without us, right? And so I'm always looking for opportunities to do things like that.
Real quick, have you noticed in your work, because again, I think we have folks here who have joined us who are working in urban cities, in the suburbs. Do you notice a difference between working in sort of the central cities in urban areas versus in suburban areas? I have some opinions about that myself, living in DC and working in the suburbs. But has that come up in your work, especially as one organization that is working across a region that is so diverse in people, in land use, et cetera? I mean, do you try to tackle things? Are you hearing the same things from folks in the suburbs as far as desires when it comes to transportation, when it comes to health outcomes, when it comes to equitable outcomes, as we're hearing in the sort of the center city? Are we hearing different things and we need to tackle them in different ways?
I'll I'll let Alex add on to this or tell me I'm wrong, but one thing that surprised me as someone who's primarily worked in Maryland learning about things in DC is that uh, folks in power in both in the city and the suburbs really like their cars. And that was something I hadn't totally anticipated, is that the sort of presence of car culture is omnipresent, and shapes conversations in very similar ways, despite like very different like built context or social contexts.
People really want to park for free in front of where they were going forever. And I understand that impulse. I drive. I love parking in front of where I'm going for free and leaving my car forever. But it really spans both DC and its suburbs. Dan and I have both done some polling in our respective jurisdictions about land use changes to promote the production of more housing. People are generally fine with like more housing construction. They're even fine with building apartments in single family neighborhoods. They are not fine about removing parking to facilitate either more space on the road for things, or just removing parking requirements to make housing more affordable, right? So that is, I think, like, not, it doesn't surprise me per se, but it's interesting to have the data on just how prevalent that is and how significant that is. And for transportation, as you all know, like, there's a geometric problem. There's only so much road. I don't think we should be discussing expanding roads. So that leaves it to a question of trade-offs. But I think also, Jamie, I would be interested in hearing some of your like things that distinguish for you, because I think like the politics actually like more alike than we might initially think, right? In part because of this dynamic around who elected officials hear from, where staff is. Like, while DC certainly has a much more greatly resourced Department of Transportation than smaller suburbs, just the dynamics really tend to be the same about these projects, I think. And you can kind of switch out the actors, but the dynamics are really, really similar.
Yeah, I would absolutely agree. Again, I live in the city, where we're reliant primarily on street parking, so parking always comes up. And then work here in the suburbs where we have a number of folks who actually are reliant on street parking because they live in historic um, area that doesn't have a lot of off-street parking because not everybody had two cars or cars that didn't fit in the parking that was built in the 1930s. To that end, I think what's very common is, and I wanted to make sure we got to some of the health issues as well, the health outcomes and health equity. But to that end, I think what's very common is that folks tend to agree that they want safer modes of transportation, that they can understand what Vision Zero means and can see that vision, and they certainly agree that transit is a great option. But when it comes to being right in front of their place of living or their place of employment, I think the challenges will not right here. It becomes, for better or for worse, a little bit NIMBY, not in my backyard or not in my front yard situation. And that is a challenge. And then it becomes, I think, on a smaller scale, but also on a larger, I think what's interesting on both the small and the large scale, or both the suburban and the urban scale, is that the politicians will then have an opportunity to micromanage some of these decisions in a way that doesn't let the practitioners necessarily really use their skill set. And then we're sent to another complete street symposium to learn about what we're supposed to be doing when really we know. So I find that challenging, and I think discussions like these are helpful for us to really broaden how we're going back to engagement, how we're engaging folks, because these are core fears. We can't change them, and we can't necessarily, just brush them off. People need their cars and love to drive in large part, particularly in suburban areas, because the transit is awful. It doesn't get them where they need to go. The frequency isn't there. It continues to get cut, and we need to be very realistic about that. The pedestrian options aren't there. Belinda's coming to tell us that we need to transition. But
I mean, if you'd like to go on with another question, feel free.
Well, I did want to, and I see, we can touch on some of the health equity aspects, I think, in the Q&A, because I see some of those coming up. But one big question, sort of just to tie a bow on this section, on our conversation before we open it up, is, in the end, what if the process is deemed equitable? We did what we were supposed to do. We reached out to everybody. We have Veronica's here with us today, and she wrote about the silently suffering. We were able to engage them. We did all that, but the outcome itself, we know at our core, is not actually equitable. You know, what do we do then? Do we look at the process? Is it the process's fault? Is it some other issue? So what if the process seems to be equitable or is deemed equitable on paper, but the outcome ultimately isn't, if we're actually evaluating our outcomes?
I mean, I guess the first thing that comes to mind for me is like the politics, right? Like what are the political circumstances that led to that outcome beyond just the public outreach, right? Because the public did what we asked them to do. What are the other parts of the system that resulted in that outcome?
Yeah, I think, you know, a concept that I have on my mind a lot is from a sort of paper by Clarence Stone, who's an urban studies thinker, that the idea of basically the process is the policy, like that those two things are indistinguishable, right? So like if you have an equitable process and the outcome isn't equitable, then sure, you can say your process was equitable, but the outcome is not. The outcome is what is ultimately meaningful to users, right? Like there will be a point at which the people who participated in the process are no longer present. So for me, equity looks like redistribution, right? There are some people who hold power. I hope that through some of the work that we do, we redistribute some of that power and agency, whether that's it's a really wide road. We've created wider sidewalks. We've added some curb bump outs. Maybe we put in a bike lane, or maybe we didn't. But maybe we put in speed bumps. Maybe we added street trees, right? Is that it's a really clear distribution of power away from drivers to other people who have just as much of a stake in that space of roadway, right? So, you know, where I'm going with all of this is kind of rambly, but I don't know that it is necessarily worth celebrating an equitable process, other than in a like, hey, here's what we learned kind of case study way, if the outcome doesn't result in that kind of, does it at least make an attempt to redistribute both some of the harms and some of the benefits. I appreciate someone putting something in here about funding and timing of implementation, because a big chunk of my job is also advocating on the DC budget. And that, you know, I'm so very tired of the phrase that budgets are moral documents, but they are. So, and I think that's something where, you know, we have in the past, like, advocated for defunding specific projects if they don't include all of the things that we want to see, which feels like it comes from a really negative place, but I think is one of the only ways that you can open a conversation about what something is supposed to look like. We caught a lot of flack for pushing to defund the K Street Transitway in DC. Once both bike lanes were removed from what was going to be a major corridor project, this was going to cost about $115 million, as well as just the bus accommodations are really not what the district had sort of promised out the gate. And we're really not going to meaningfully improve times and speeds for bus riders, right? So overall, it was like, we're about to spend a lot of money on something that then won't be touched for another 25 years because it was a huge capital project. And what can we do with this instead? We had advocated putting that into funding fare-free Metrobus for DC residents. That did not come to pass. Actually, ultimately, that funding went to emergency rental assistance. It was kind of a wacky trajectory, but I remain very proud of that arc, even though it did seem like it was coming from a negative place, because that was just a large pile of capital dollars that really was not going to have a useful outcome for many, many users.
Thank you. And in transitioning, Alex, since you started to transition to some of the questions, and I don't want to necessarily go backwards, but one popped right into my face, and I wanted to touch on it, and it's also kind of attached to budgeting. Was how can public health practitioners contribute to health equity in the transportation space? And one response is doing health impact assessments, which I think traditionally is a great response. And in reality is an extremely difficult response, because a health impact assessment or an HIA requires a great amount of resources. It's something I have wanted to do for years and years and years and years, and have not been able to. Even when I was with the Office of Health Equity, I was sort of tasked with devising something else, another tool that wasn't as onerous, so that we could move in time with a small area planning process with the Office of Planning. And so I think what we really need to be thinking about are these other opportunities that aren't necessarily full-blown health impact assessments, and really discussing those more. And I think that some of the great opportunities that exist, not that I wouldn't want to do a health impact assessment, but the timeline doesn't work either. So for instance, we recently received notification of award for a Safe Streets and Roads for All grant here in the city. We're going to do a Vision Zero action plan. And one component of that I have called is a health equity assessment. I still haven't quite fully built that out yet, and will with the RFP, but it will not be a health impact assessment, but will be one way that I'm hoping that we're able to start to fold in health equity into our work. And not only on the transportation side, but it happens to be that the transportation side, because of this grant funding, is the way that we're going to be able to start doing that, to get some baseline data. And I think the other challenge with health impact assessments, also for smaller jurisdictions in particular, is that we don't have our own public health department. So I don't have a public health planner. You know, we have a county public health department, but we haven't always been working closely with them. That's another goal, and another thing on my to-do list is to start working closer with them. But I have been seeing more and more public health departments, just like I was a planner in the public health department in DC, hiring planners to be in there to work on built environment things, policy in particular, through that health lens.
Yeah, I think this goes back to what I was saying, at the beginning, which is that the risk of overthinking things, right? It sounds good to do a big health impact assessment, but as Jamie pointed out, they take time and they take money and resources that may not always be available. And a risk, I have encountered is that you're in doing an assessment like that, you're creating another process that itself may not be equitable, result in an equitable outcome. In Montgomery County, Maryland, where I do a lot of work, we require racial equity and social justice assessments for most legislation that goes through the county council. And one such analysis for the county's comprehensive plan came up with the conclusion that walkable neighborhoods were not equitable and that they only benefited white people, which honestly just defies common sense. And also really damages the credibility of the planning staff who put together that report, the advocates who supported the project, and any elected official who dared step in front of it, because now you've concluded through an analysis it's not equitable, despite the fact that some of the conclusions don't really stand up to any scrutiny. And it took a lot of time and a lot of money to do. Like I said at the beginning, I think folks have to be mindful of these simpler explanations for things and willing to accept an approach to assessing the health impacts or the racial equity impacts of something that are, I think, right-sized for the project and its needs in that community, and also are willing to embrace what might seem an overly simple or straightforward conclusion.
I think.
Well, go ahead, Alex.
No, go ahead.
No, I was going to see if there were other, but if you wanted to tie up this question, and then we can move on to another one.
Yeah, I mean, just really quickly, provide for public health practitioners, provide data, give everything you can when you are asked for it. I know that may be harder than it sounds, but there's a slide that I slipped in this, Belinda, if you don't mind, I think it's the last one. We did this big report in 2022 on like racial equity and public health. This is DC specific. I just put the link in the chat. But this map looks like a lot of other maps in DC. In order to create this map, it required just like a lot of data. This is a pretty intensive report. It was supported by the Robert Wood Johnson Foundation. I use this map all the time to basically just like public health outcomes are really, really bad in DC. The status quo is really inequitable. Now we have a map to show that, but this map took a lot of work and a lot of data, and it wouldn't have been possible if we weren't working directly with public health practitioners. We spent just a lot of time with both Jamie and the George Washington University's Milken School of Public Health. So just share what you have when you're asked for it, and proactively put out what you have. Open data is just like enormously valuable for some of this, even if it's not a data set. Anecdotal and qualitative data is also super helpful. And public health practitioners, whether you can do this professionally or in like your own community as a resident, like show up and support things from a public health perspective, not necessarily like, you can bring your expertise both to things that are like outside the scope of your work, right? A lot of times people ask me how to get involved with GGWASH, and I tell them that they really just need to be involved in their neighborhood, less so with us and more so with the wider world. And I know you all are thoughtful and conscientious people because you're on this webinar with us, but that, do get that out also in your own, through the sort of public forums in your own community, to the extent that this is possible from a public health perspective. The last thing I'll say in this report, because I'm going kind of long, is that we applied for this grant to support this report, in part because we were like, well, we talk about transportation a lot, but we don't have a thing that sort of yokes together transportation and public health. So the point of putting together a very, very long paper basically was to say, like, we are thinking about these things together. And it's been valuable to at least have a resource to say that, like, yeah, we are looking at this from this perspective, even if we're not saying it all the time, even if it's not first and foremost in our work, we do think about it. We talk about it. And like, this is actually something that we spend a lot of time and a good amount of money on producing so that it can inform the work that we do.
Thank you, Alex. I'm going to go back a little bit to see some of the earlier questions. I know that ZNAT had submitted a question, and I wanted to know, hopefully I'm pronouncing your name correctly, but please correct me if I'm wrong. Would you like to go off mute so you can share your question yourself?
He did not have a question. It was more of a comment, stating that we were in the state of Michigan doing a project with MDOT for this exact purpose, to see how to get to the vulnerable residents who will not attend meetings. And I just wanted to share, the study is still ongoing. We've spoken to DOTs and we've spoken to residents. The regular stuff has already been mentioned, the incentives, the childcare, the food, the transportation. But then the things that are coming out are, how do you influence the influencer? Okay. When the folks within agencies that are tasked with doing these kinds of engagements, and there is a miscommunication between engagement versus outreach. You can't get the engagement, you do the outreach. We've given the information, they know how to contact us, type of thing. But community-based organizations are the ones that are closest to the residents. And so if they cannot attend, at least they can pass on their feelings about certain projects and things like that to the community-based organizations. And that's how you can get an in to these groups who just think that they don't want to hear from us. So why am I wasting my time? So I just wanted to add that insight.
Yeah, I
Thank you.
really appreciate that, because I think that is one key thing that planners and agency folks can do, right, is actually building relationships with the organizations and the community that are doing the relationship part, right? It seems like every project starts from scratch. We're going to have our public meetings or our public outreach, and we all over again, we have to introduce our project and who we are to members of the public who might be coming for the first time. and may not be able to participate or contribute to the extent that they fully should be able to because of it, right? And when you're able to build long-standing relationships with community organizations, and I'm not just talking like, you know, neighborhood associations, right? But like religious communities, social service organizations, and so forth. Uh, you're gonna get more meaningful and robust engagement that way, and most importantly, like trust, right? The kind of trust and relationships that you need to actually do things. And you know, one thing that we always say in our organization is that like everything is built on relationships, right? And one way you can achieve better outcomes is by having more relationships with different sections of the community. Ooh.
Okay, I just posted in the chat that we have time for maybe 1 or 2 more questions, and I'm simultaneously also putting our feedback survey just in case we run out of time. We'd love to hear your feedback for everyone who's attending. I saw that Fatima had shared a question, Elcott. If you'd like to come off mute, we'd like to invite you to share your question or comment that you had.
Hey, first of all, thank you so much, Zinat, for sharing your feedback. That's like, I really resonated with that, and that's something that we've been doing in Florida. So I'm just very excited to hear about that work and glad you guys are doing that. I appreciate the panelists as well. Thank you so much for taking the time today. I'm trying to look up my question. I know that overall, okay, yeah. What do you guys believe about actually connecting with communities? I feel like in the beginning of the conversation, I get it. Like, I've been in organizing and nonprofits for a long time. Like, burnout is real, and like dealing with the plethora of human existence is exhausting. But I personally, I don't know if it's because I'm naive, do believe that when we do authentic connection and engagement and truly like have culturally relevant, use art, use that influencing the influencer, like really embed ourselves into what the community is already doing instead of just like standing at the bus stop and getting things we always have to do, but in concert with like being active participants of the community, which is not, you know, against capitalism and the processes that we're working in, of course. But I do think like hopefully our profession, especially in this intersectionality between human rights things like housing and the freedom to move and the freedom of access to all the things we all feel holistically about, you know, I think if we don't really practice a holistic approach to really inviting community members to co-create whatever that process is as much as we can, I don't know, I still believe in that. So I guess like my whole kind of rant was like, what do you guys think on it? Like truly, like with the kind of climates that we're in, like with everything that you guys have been years in this work, is that truly possible to believe that we can have that kind of shared process and imagine how we do these things differently? Or is it kind of like, you know, more of so the things you guys say, like really focusing on the policy and keeping and pushing in that direction? And I don't know.
I think
Yeah.
oh, I was just going to say very, very quickly, and I hope it relates to this, but a point I also wanted to get in. Yes, I don't think that's naive. I believe that's the ideal, that we get to this co-creation, and that like, as kind of silly as the word community can sound after you say it a million different times, you know, ultimately I want to be a part of this community in which I am a community planner, and I would hope that I can be, and that we can build those relationships. But it requires, I think, time, and that's something that in our capitalist society we have lost the patience for. And so, you know, a lot of times you'll hear again the well tread, it's not a sprint, it's a marathon. And I don't believe that. I believe it's a relay. And so that may not, some of these things aren't going to happen under my watch, even if I'm able to lay the foundation for it. And so at the very least, I think it's incumbent on us to lay that foundation of trust and to begin to develop that relationship. But we need to be willing to pass it on to whoever comes next as well. And we need to not just be willing to, but be able to and enabled to, which goes back to political leadership, and things like that. Like it's kind of that holistic view. So yes, in a very sort of ethereal way, I believe in all of that. And it's one of the ways I think I continue to get through on my day-to-day is knowing that, or hoping and believing that I'm at least laying a foundation if I don't actually get to see the final product at this point of whatever it is that we're working on.
Do we have time for one more question, or Alex, do you want to quickly jump in?
Well, and maybe we can end on this a little bit, is that I think I always really enjoy talking to people about like when there's not a project, right? When there's not a project and there's not a plan and process, right? And I think like Fatima, like you have a lot of really strong points here, and projects, just like the specifics of projects, like yes, often public outreach is required, public feedback is required, we should do it, it should be inclusive, but they tend to just be like not great forums for understanding what people want. And I love hearing from Zinat like that there is work to understand both like why people don't show up. I would also love to see us, do more to figure out what people want and and just sort of go do it, right? So it takes a really long time to finish these projects, whether it is a roadway redesign or or a new housing development, right? And I think people need to see stuff built so that they can respond and react and give more opinions. And when that, it's really hard to keep people organized and keep them showing up over like 5 years. That's really unfair, I think. And that the more that we can diffuse things away from an individual project and understand better what residents want as a general matter, that feeds back into the not typical, but back into a political engagement, right? That what people are showing up to vote for is elected officials who will represent their interests, and we can better draw out those interests when it is less tied to a bike lane or a variance to build a denser building. That's something that just I wish we had more of, and we just don't, because things tend to be really, really project focused. And I feel very lucky that my job allows me to zoom out from the projectness of it all and think about what this means for people generally. And that's something that I would love to see the planning profession take up more of, which is a little bit more sociological in some ways. So part of that is just, where is the field working and what are the constraints of what we're all doing in our day jobs and what we want this world to be.
Thank you, Alex. Thank you, Dan. And thank you, Jamie, for taking the time out of your days to have the session with us. Thank you to all the attendees for joining. If you haven't had a chance already, to please submit your responses for the feedback survey. I wanted to note that obviously you all were able to see the notifications for this webinar. I do also send these reminders and announcements over email to you all. And there are some bounce backs, especially if you work for a state or city government. So to minimize that, if you don't mind adding our email address, which is on the page that you see right now, that would probably help reduce the number of bounce backs so you can make sure you don't miss any updates from us. We'd love for you to join us at an upcoming event that we will host, and we will share any announcements on our socials as well as through email. So thank you again for joining us, and we hope to stay in touch with you all.
Thank you so much. Thank you all.
Everyone.
Bye.
Bye.
Speakers, don't leave yet.
Okay.
Almost got me there.